Hello everyone. Today, we're diving into the world of a medication called Inbrija, whose generic name is Levodopa inhalation powder. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Inbrija, Levodopa inhalation powder, is an inhaled medication used to treat symptoms of Parkinson's disease. It is particularly effective in addressing OFF episodes, which are periods when the regular medications that manage Parkinson's symptoms wear off and symptoms like tremors, stiffness, and slowness of movement reappear. Approved by the FDA in 2018, Inbrija is used in conjunction with a regular Parkinson's medication regimen that includes a carbidopa/levodopa treatment. By providing an additional dose of levodopa directly to the bloodstream via the lungs, Inbrija helps to quickly alleviate the motor symptoms associated with OFF episodes, providing more consistent control over the condition. Warnings: Inbrija comes with specific warnings and precautions. It's crucial to note that it is not intended for use as a primary treatment for Parkinson's disease but rather as a supplementary medication for managing OFF episodes. People with a history of lung disease, such as asthma or chronic obstructive pulmonary disease, COPD, should exercise caution as Inbrija can cause bronchospasm, a serious condition where the muscles around the airways tighten, making it difficult to breathe. It's also important to avoid this medication if you have any known allergies to levodopa or any of the other ingredients in Inbrija. Before taking this medicine. Before starting Inbrija, several factors need consideration. Inform your healthcare provider if you have any lung conditions, including asthma or COPD, as Inbrija can exacerbate these conditions. If you have a history of cardiovascular issues, such as heart disease or arrhythmias, discuss this with your doctor as levodopa can influence heart function. Additionally, it's essential to notify your healthcare provider if you have any psychiatric conditions, including depression or a history of hallucinations or psychosis, as levodopa can exacerbate these symptoms. Women who are pregnant, planning to become pregnant, or breastfeeding should consult their healthcare provider before starting Inbrija. It's also crucial to inform your doctor of any other medications, supplements, or herbal products you are taking to avoid potential interactions. Side effects: all medications can have side effects, and Inbrija is no exception. Common side effects include cough, upper respiratory tract infections, nausea, and changes in taste. Some individuals might experience more severe side effects such as bronchospasm, low blood pressure, dizziness, or fainting. There is also a risk of experiencing dyskinesia, which involves involuntary muscle movements that can be bothersome. Additionally, Inbrija can cause more serious side effects, including hallucinations, psychotic behavior, and impulse control issues such as compulsive gambling, increased sexual urges, or other intense urges. If you experience any of these symptoms, it's important to consult your healthcare provider immediately. Interactions: Inbrija may interact with other medications, particularly those used to treat psychiatric conditions, certain blood pressure medications, and other Parkinson's disease treatments. It's essential to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Inbrija. The usual dose is 2 capsules, 84 mg, inhaled as needed, up to 5 times per day. It's important not to exceed the prescribed dosage and to use the medication exactly as directed by your healthcare provider. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. Avoid: while on Inbrija, it's advisable to avoid activities that require full alertness if you experience dizziness or drowsiness as side effects. Alcohol can exacerbate certain side effects, so it's wise to limit or avoid alcohol consumption while using this medication. Additionally, ensure you do not exceed the recommended dose and avoid using other inhaled medications simultaneously unless approved by your healthcare provider. FAQ: many wonder about the age restrictions for Inbrija. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing: that wraps up our overview of Inbrija. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.